It turns out that cardiac surgery has a long-standing relationship with opioids. Opioids have been the backbone of the cardiac anesthetic ever since the 1960s. Dating all the way to the turn of the century, there was something called fast-track cardiac anesthesia, where there was an attempt to reduce the level of opioid use. It still turns out that the majority of patients still receive more opioids during the course of cardiac surgery than any other subspecialty. This leads to some complications. There are patient-related complications, including ileus and some other issues with things like hyperalgesia and longer-standing opioid issues like persistent opioid use after surgery. Turns out cardiac surgery is one of the biggest implicators in that phenomenon. And so one of the interests that I personally have is this idea that we can really curb that opioid requirement. And the biggest piece of that is to think about something called multimodal analgesia. Essentially what we do is we re-envision the cardiac anesthetic from the beginning. We think a lot less about using opioids as the cornerstone of that anesthetic, and we apply a number of different agents from different classes of medications with the intention of reducing opioid requirements both in the procedure and then subsequent to the procedure so that those patients after surgery can recover in a more expeditious fashion, but more importantly, when they leave and go home, they no longer require those opioids long term. And the idea here is, or I should say maybe the promise of this strategy, is that patients can come in, they can get their surgery, they can recover as quickly as humanly possible, and then leave without any long-lasting effects that are simply side effects of the anesthetic selection that we had during the course of their procedure. There has been a lot of interest in the use of multimodal analgesia and anesthetics in general across a number of different service lines. There are only a handful, however, across the country who have been genuinely interested in this in the setting of cardiac surgery. I'm only aware of a handful, and Johns Hopkins is really leading the pack when it comes to using this across every single individual patient. Multimodal analgesia is a big component of something called enhanced recovery after surgery, which is something that, again, we're leading the charge at Johns Hopkins across a number of service lines, and the area of particular interest for me personally is in cardiac surgery.